So we've actually got evidence to show that oncology patients that used our product improved their quality of life by 15% in just 30 days,
Wow.
which may not sound like a lot, but we haven't actually come across another product or trial that's ever achieved that in just 30 days. Yeah, so I've worked as a radiation oncology physician when I practiced and trained in Australia. I then, moved into this new field of digital medicine with my first startup. And, for me, I think, we've seen how different companies can influence clinical outcomes by using digital health. So really from the start, we really wanted to increase patients' participation in their own health that are affected by chronic disease. So I don't know if you've seen the movie Her, India, with Joaquin Phoenix and Scarlett Johansson, but it's
Haven't.
basically set in the future. Joaquin Phoenix plays this lonely guy who's kind of going through life, and then he gets this operating system played by the voice of Scarlett Johansson. And over time, she gets smarter and smarter, and she organizes his life, and he ends up developing a relationship with the voice. And so my co-founder Simon and I, we saw that movie and we thought, how can we take elements of that movie and apply it to people impacted by chronic disease? So we really believe we're pioneering a new vertical in healthcare, which is this kind of term we've coined, which is called smart audio companionship. Yeah, so each day patients log into the app. It's on the App Store for iOS devices, and they interact with a persona whose name is Elly. So, we're big believers that the human voice is a critical part of building relationships and having that human connection. So each day they receive content primarily through audio. So they can receive a daily Elly, which is a short 90-second audio message, where, as you said, Elly starts with a motivational story. She then discusses a condition-specific topic, and then leaves patients with an inspirational message. So the idea is it's a short, bite-sized piece of content that patients can easily incorporate into their daily routine. But we've also got exercise videos, we've got meditation practices, sleep stories, and probably our most popular type of content is actually our sessions, where we actually interview different patients from all over the world who have had a chronic condition, and they share their experiences through voice and through these sessions, which our users can engage with and learn from, which is quite cool. Yeah, so we've actually got evidence to show that oncology patients that used our product improved their quality of life by 15% in just 30 days,
Wow.
which may not sound like a lot, but we haven't actually come across another product or trial that's ever achieved that in just 30 days. So that's really the key positioning of Elly, is we say patients can feel happy in a very short period of time. But we also found that patients, incorporate Elly into their daily routine. So some patients listen to Elly first thing in the morning to get inspired to go about their day. Some patients listen to Elly before bedtime to relax their thoughts. And then some patients listen to Elly in their work breaks to kind of have a break. So, we've seen different use cases of how people have incorporated Elly into their daily routine. I think now that, everyone's at home on their devices and during the pandemic, really needing to have content and support to do healthier health-seeking behaviors in a way, which is where we kind of want to position Elly as the product. Yeah, we'd love to, onboard new people that have been impacted by a chronic condition. So they can reach out to us through the website or, through the app itself, and we can work with different contributors in different ways. So we sometimes interview contributors who will share their perspectives. Some are skilled writers, so they actually write for us. And then some are actually, they could be doing podcasts, or they could have voice recording equipment at home. So we actually use their recordings. So there's a few different ways we work with contributors. We're very flexible. We're always looking to kind of have a very diverse and inclusive and culturally sensitive kind of range of contributors. And we've got about 60 to 70, I think, now that we've started working with, and we've got a library of about 800 sessions that we've already recorded. Yeah, 2021's set to be a good year for us.
Right.
We've just closed our pre-seed financing round. We've had some great new strategic investors that have that we partnered with, including Morgan Stanley, Snap, and as well as Bayer, the pharmaceutical company. So for us, key objective this year is to get Elly in the hands of as many patients as we can, We've got some really cool opportunities with kind of refining our business model and reaching more patients. And we're always looking to, work with different people and contributors in that way as well. So we're excited. We've got some great partners that are backing us, and look forward to the outcomes we can achieve.